We are here at California Equine Orthopedics. Dr. Rantanen is reevaluating Tehya. We'll be taking some scans and giving her the once-over.
So, Jeff, this was the area down here that was enlarged, and you can't feel any enlargement. The tendon is small. You can separate it from the deep flexor. You can twist it almost 90 degrees underneath the skin. Horse does not resent it. This is what you're looking for a successfully rehab tendon. Small, rubbery, able to separate from the surrounding tissues, no pain. This is the endpoint that you and I have been talking about for the best case scenario for horse.
Excellent. Thank you, Doctor. So, Doctor, as is normally the case, we'll evaluate both legs in terms of a comparison?
Yes. Now, we don't expect anything to happen to the normal leg during rehab, but unless somebody snuck in at night or the horse took off on a vacation we didn't know about. But I always like to compare them. Sometimes after we treat aggressively, and if we only use the game ready on one tendon, the injured tendon will actually be a little smaller than the other one because there's enough venous congestion to increase the size of the normal tendon. So most of the time when we use the game ready, we plug it into both legs.
We're done with the scanning, and now can you explain what you're doing on the computer?
Whenever you do a scan on a patient, you have to go back through it again. Check it for quality. We usually check quality as we do it, but we go back and ensure that we do have good quality scans, and we do measurements. And we want to do the measurements when we're a dancing horse with flies biting us, so that we can stay within the lines when we start tracing things. But measuring the area circumference is really important, and it's a very sensitive indicator of what we're trying to achieve. Right in the middle of the tendon at 0.6 of a square centimeter. When it was injured, it was just under a square centimeter. It was 0.94, I think it was, when it first happened. So it's a significant amount of increase in size when it's 0.94. When we get it back to a 0.63 size, that means that we're sucking this thing down to where it should be. In other words, a normal tendon size. The published values for thoroughbreds is up anywhere to about a square centimeter, but most of the time they're less than that. I get nervous if they're over 0.9 at any level, especially in a young thoroughbred. Yeah, I couldn't be happier with the way this thing feels, looks, bends, and what have you. Now with a few preliminary measurements through the area that was affected that used to be 0.94 square centimeters, we're down just over 0.6. So that means all the bad guys that were in there making that tendon bigger gone. All the fluid congestion and all of that stuff is out of there. So we're looking at essentially a new tendon that's in front of us so that we can move on. So to sum up what we're looking at here, Jeff, when you rehab a tendon and you get to this point at this stage, 9 months or so into the thing, we've got the size back, we've got the elasticity back, we've got no sensitivity and what have you. This is as good as it gets. This is the end point that we'd like to have all horses reach. If you don't, then that always increases the risk that there'll be a recurrence.
And so as we were talking earlier, the thinking is maybe give her another 30 days of just light exercise, meaning walking out at the farm, and then ease her back in to training slowly with some tack walking and jogging, etc.
Yes, I think that's advantageous. A lot of horses can't enjoy that luxury of somebody being a little more conservative and giving them more time, and I really do think that it makes a difference in success. We know that 5 to 7 months, if they go back, that there are total disasters on those. We're not really sure at what time we should really be bringing them back, but it's probably somewhere between 10 and 15.